All right, so basic anatomy and physiology, I think, is the best place to start when we're trying to figure out how the heart works. Anatomy and physiology. Anatomy just means the structure of the heart, and then physiology means the function. How does it work? And so let's talk about the structure and function of the heart. Specifically, how does blood flow through the heart? We talked about a deep vein thrombosis, which is a blood clot in your leg. If that blood clot breaks loose, it's going to shoot up toward the heart in your veins, your venous system. Has anybody had a DVT that you know of? I usually have about one nursing student per semester who gets a DVT. It's fairly common. It seems like the combination of birth control pills and smoking is a recipe for blood clots in your legs, DVTs. One of my classmates in nursing school had to take an entire year off because she had DVTs in her legs, which did break off. The blood clot broke off, traveled through her heart and into her lungs. She had pulmonary embolism. So if we're thinking about how blood travels through the heart, let's take a look at this heart here and figure it out. The first thing to know is the blood coming from the body travels to the right side of the heart first. And so on this plastic heart here, this is the right side. This specifically is the right atrium. The right atrium, and then the right ventricle. If you're actually listening to a person with the stethoscope on their chest, you're mostly listening to the left ventricle because the heart is kind of placed in your chest with the left side at the forefront. This left ventricle, which is about right where my hand is, that left ventricle is the most important one. You've got 4 chambers in your heart. You've got the right atria, right ventricle, left atria, left ventricle. We really don't care about 3 of those chambers. That left ventricle is the only one we really care about, because the left ventricle is the workhorse of the heart. The left ventricle pumps blood throughout your entire body. So if you feel your pulse right now, you could check your radial pulse or your carotid pulse. If you feel that pulse, what you are feeling is a contraction of the left ventricle. We only care about the left ventricle, and if it stops, you're dead. You don't have a pulse. But when blood flow is returning to the heart, it actually comes through the venous system to the right atria. That's where it starts. This blue thing on here is what we would call the superior vena cava. Superior vena cava dumps blood into the right atria. If I take this apart a little bit, can't really see too well on there, but I just took the right atria off, and here we're looking down into the right ventricle. Do you guys see down in there, there's this little white thing? Any ideas what that might be?
Bicuspid valve.
The tricuspid valve. So you have valves in your heart, 4 altogether. We have 4 heart chambers and also 4 valves. When you listen to somebody's chest with your stethoscope and you hear the heart beating, sounds like a lub-dub, 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 lub-dub. What are you actually hearing? What you're hearing are those valves snapping shut. There's 4 valves, but you only hear 2 heart sounds. That's because 2 of them snap shut at the same time and create the lub sound, and then 2 more snap shut, create the dub sound. So blood comes from the superior or inferior vena cava. You can see on the back side, I think this is supposed to be the inferior vena cava. Basically, all the blood flow from your head and your neck travels to the right atria. This direction, blood flow from your legs, your abdomen flows upward, and it all dumps into the right atria. From the right atria, it goes through the tricuspid valve into the right ventricle. Right ventricle, vitally important. Not as important as the left ventricle, though. But the right ventricle pumps that deoxygenated blood somewhere very important. Where do you suppose the right ventricle pumps blood to? Did you say the lungs? The lungs, yep. So the right ventricle, very important, pumps blood to your lungs. That's deoxygenated blood, pretty dark blue. It's not really blue, but it's not carrying oxygen, so it's not bright red like arterial blood. Let's see what happens if I take this ventricle apart. Oh, check that out. So I took the ventricle apart. Here is the right side. We've got that tricuspid valve and then the right ventricle. And then that right ventricle pumps blood up. There's another little hole here. I don't know, you can see where my finger is. That little hole. Let me put the top back on. The right ventricle pumping blood up, and it has to go through a valve. And that valve is called the pulmonic valve. I don't know if you can see that white, round, it's kind of weird that I'm doing this on Zoom. I've never done this before. Awesome. Right ventricle pumps out through the pulmonic valve to your lungs, So if you have a blood clot in your leg that travels to your heart, it's going to go through the right atria and then through the right ventricle, shoot up through the pulmonic valve, and land in the pulmonary artery. And if that's a blood clot, it's going to plug it up. If it plugs up your pulmonary artery, what do you suppose happens to that patient? I'm talking about a pulmonary embolism. That patient will complain of shortness of breath, makes sense, suddenly really short of breath, and they'll usually complain of chest pain. So pulmonary embolism, 2 chief complaints, dyspnea or shortness of breath, number 2, chest pain. And it usually just happens like that. And the reason it happens so fast is 1 minute the blood clot's in their leg, next minute it's in their lung. So if you have a patient walking along, everything's great, and then he says, bam, crushing chest pain and I can't breathe, blood clot in their lung. That's actually the number 2 and number 3 presenting symptoms of a PE, the most common presenting symptoms. Number 2, shortness of breath. Number 3, chest pain. What do you suppose the number 1 presenting chief complaint of a pulmonary embolism is? You have a huge blood clot that just lands in your pulmonary artery. The pulmonary artery on this heart model is best seen from the back side. So I've got my heart. Let me put the heart back together. If I turn the heart around, the pulmonic valve leads to what's called the pulmonary artery. Notice there's a pulmonary artery shooting this way and another one shooting that way. It branches because you have 2 lungs. The worst case scenario of a PE, I had a truck driver. He was traveling down I-80, and I think he was delivering cattle, driving a cattle truck. And the problem with a truck driver is they are sitting for 10 or 12 straight hours driving their semi. He had what was called a saddle emboli. His blood clot was so big, it completely plugged up both branches of his pulmonary arteries. And so when they did a CAT scan, they could see it sitting here, and it has a characteristic shape. The blood clot has a shape that looks like a saddle that you would put on a horse. Saddle emboli. Just a little bit of blood squeaking on past that blood clot, which is why he was still alive. Which leads me to my number 1 presenting chief complaint of a PE is actually death. That's usually what these guys present with. And usually this is a patient who just had surgery. Just had surgery, they've been on bed rest for a day or 2. Throw a huge blood clot, it travels from the inferior or superior vena cava into the right atria, past the tricuspid valve into the right ventricle, shoots up into the pulmonary arteries, which there's 2 of them because you got 2 lungs, and either chest pain, shortness of breath, or death is their presenting complaint. If they make it through that initial hit of the blood clot landing, they're probably going to be okay, as long as we get them on blood thinners immediately. From your lungs, when you take a deep breath, you now are oxygenating your blood. Where does it go from there? After your lungs, where does the blood go?
The left atrium.
Yes, the left atrium. Atria is plural. Atrium is singular. It's a left atrium. This is your left atrium. It's kind of hard to see on this model, but we've got the right atrium. I keep saying that wrong. Atrium, and then the left atrium. Not a very big chamber, is it? Just looking at it, it's not super impressive. And in reality, we don't care a whole lot about our atria, the right and left atria. We don't care a whole lot. In fact, you can develop a condition called atrial fibrillation or atrial fibrillation, where both of these chambers, right and left, aren't working very well. They're just fibrillating. They're not even pumping any blood. And we don't care too much. Those patients tend to do fine. About 15 million Americans are walking around right now with AFib. AFib, the right atria, left atria, not working well. They're not contracting, they're just fibrillating. In a normal functioning heart, though, from the left atria, where does the blood go?
The left ventricle.
Yep, the left ventricle is the only ventricle we really care about, the only chamber we care about, because that's what's generating your pulse. We do care about the other ones, but that left ventricle is the one we're going to talk the most about in this class. So the blood goes from your left atria through your mitral valve into your left ventricle and up through the aortic valve, which I don't know if you can see. This is the left ventricle. That's the mitral valve. And then I probably have to take this guy off of his thing. I don't know if you can see that. It shoots up through the aorta. Kind of hard to see. The aorta on the top is this big red thing. The aorta. So what's the name of that valve? The aortic valve. The left ventricle pumps blood through the aortic valve into the aorta. Notice that aorta takes a right angle turn immediately after leaving the heart. That's what we call the aortic arch. To see here how it curves. That's because most of your body is down below your heart. So most of your blood flow needs to shoot off down to supply blood to your body. Notice these little branches off the top here, though, of the aortic arch. Where do you suppose they go? Those are arteries branching off.
Your arms and your head.
Yeah, your head primarily. Your carotid arteries that travel up your neck. So if you have a patient whose atria are not working well, they're fibrillating. The biggest thing that causes blood clots is immobility. So our guy with his blood clot in his leg, he was on bed rest. Or he could have been a semi-truck driver who never gets up and walks. Or he could be on an international flight from here to, I don't know, someplace that's 18 hours away, maybe in the South Pacific. If you're on an airplane for 18 straight hours, you're not walking around, blood pools in your legs, it stagnates in your legs and you form clots. The same is true with atrial fibrillation, where these two chambers are not pumping blood. Blood tends to pool in those chambers, and that leads to the biggest risk of having AFib, which is a blood clot in your left atria that breaks loose. That blood clot in your left atria breaks loose, where is it going to go? It's going to shoot down into your left ventricle. That left ventricle is pumping blood to the entire rest of your body. But the most likely place that blood clot is going to land. It's going to shoot straight up, and see how it's a straight shot through one of your coronary arteries, and it's going to land in your brain. And what do we call a blood clot in your brain?
Is that an aneurysm?
No, it's technically an ischemic stroke. So an aneurysm can cause what's called a hemorrhagic stroke, and a blood clot can cause an ischemic stroke. Both really bad, and they look the same. They're both a stroke, but one is caused by a blood clot, and one is caused by bleeding in the brain. Most common, and by common I mean 80% of the time, if you have AFib and you break a blood clot loose, 80% of the time it's going to shoot straight up and land in your brain. So a leading cause of stroke, which is like the second cause of death worldwide, a leading cause of stroke is AFib, which is when your atria, the top two chambers of your heart, are not pumping effectively. Any questions about that? It was a real quick overview of the anatomy of the heart.
I actually have a question. What do you think causes like aortic aneurysms to occur in younger children?
An aortic aneurysm, and the book does talk about, it has a little bit about that, but usually if it's a younger person, it's almost always genetic, something genetic, specifically a problem with connective tissue. So an example from the book would be Marfan's disorder, which I think was in the genetics chapter. Marfan's is also in the cardiovascular content because what happens with those connective tissue disorders is the blood vessel weakens. It weakens. And if you think about it, that left ventricle is pumping blood at a very ferocious rate and pressure. And so you have to have pretty good blood vessels to contain that rate and pressure. And if you have a collagen or genetic disorder with connective tissue or collagen or something like that, you can have a weak blood vessel, and then the pressure of that blood pumping against a common site. I don't know if you can see my aorta here. The blood is pumping straight up, and then it hits that arch, and a lot of the blood has to curve around that arch. So a common site for an aneurysm is right here, where it's high flow and high pressure. That blood hitting it, the vessel wall weakens, and you start to get an aneurysm is a ballooning out, a weakened portion of the aorta. Very rare in children, though. It's not very common in young people. Any other questions along those lines?
I have a question in regards to the AFib. Are there symptoms with that?
Yeah, the biggest symptom of AFib is just pooping out, getting tired. Because I said earlier that the atria are not that important, but they do provide about 20% of your cardiac output. And so what happens, and this happens to my dad regularly because he's had a few heart attacks now. He's 76 years old. And every once in a while, he bops into AFib. And it's usually when I'm lecturing about AFib. That seems to be when he chooses to. So the way that goes down is I'll be talking and then I'll get a text message and he thinks it's funny to just take a picture of his 12-lead EKG and send it to me with no warning. And so then I'm like, oh, yep, AFib again. The way he knows he's in AFib is suddenly he gets short of breath walking up a few stairs. When he's not in AFib, his cardiac output is better. But suddenly you drop your cardiac output by 20% and you can't walk up the stairs to the classroom without getting very winded. So that's often the common sign and symptom is just shortness of breath and fatigue. Any other questions? My dad bought now the Apple Watch can detect AFib, which is nice. I actually have, I'm just trying this little fitness tracker called a Fitbit. It's a Fitbit Sense, and the Sense can also now check for AFib. So it's kind of a neat little device. I like the Fitbit better than the Apple Watch because the battery life on the Apple Watch is terrible. And you have to charge the Apple Watch every night. And so if you bump into AFib at 2 a.m., Apple Watch isn't going to tell you because it's on the charger. This Fitbit has about a week battery life. So I like it a little bit better than the Apple Watch for that reason. Any other questions? How are we doing for time? We're going to take a break at 2, so. One other thing about this plastic heart here that I wanted to point out is on the outside of the heart are some very important blood vessels. These are called coronary arteries. Coronary arteries. On here, the arteries are red and then the veins are blue. But you can see this is the left ventricle, the biggest part of the heart. If you look at how thick that ventricle is, I don't know if this shows it as well as, see how thick this muscle is here? I mean, obviously this is a bigger heart than real life, but if you wanted to, if you're interested in heart anatomy, if you go down to Russ's grocery store, you can probably buy a cow's heart. And I meant to bring one to class, but it's kind of gross and I'd have to put gloves on because it's just raw meat. It looks a lot like a steak. If you were to chop the cow's heart, it looks just like roast beef. Anyway, big old heart muscle. Well, how does the muscle itself get blood supply? All this blood flowing through the chambers does not feed the heart muscle. And it's a muscle just like your leg muscles. If you were to go running after class today, when you're running, you can feel that burn in your leg muscles when they stop getting enough blood flow. Well, how does the heart muscle get blood flow? All the blood flowing through the chambers does not feed the muscle. It has to have its own supply. And that supply comes on the outside through the coronary arteries. And so you can see different coronary arteries feeding the heart muscle. Kind of works pretty good in here because you can see it on, I have the zoom pulled up on the TVs in here. Just kind of a cool little thing. if you want to be a cardiac nurse, when you grow up, cardiac stuff is my favorite type of patient, but you will have to learn all of these different coronary arteries. We talk a little bit about it in patho, but once you are working in a coronary ICU, which either like here in Lincoln would be the Nebraska Heart Hospital, or at Bryan East, they have a whole CVICU. So the different coronary arteries feed different parts of the heart muscle. This one that I'm pointing at here starts out actually up under this left atria. I'm just going to take the whole atria off of here. And so you can see where the left coronary artery starts. And where it actually starts is it's feeding right off of the aorta. It feeds right off the aorta. That white thing there is the aortic valve. And then this part of the left coronary artery is called the left main. The left main then branches into the left circumflex that travels around the backside here. The most important coronary artery from the left main is what we call the left anterior descending artery, the LAD. If you get a blood clot in the left main, you're probably a goner. If this portion of the coronary artery plugs up, and that's what we call a heart attack, an acute myocardial infarction, AMI. You get a blood clot that lands right there. You don't have any blood flow down the left anterior descending, and you don't have any blood flow down the left circumflex. These two coronary arteries are feeding that entire left ventricle. You get a blood clot called a heart attack, you kill off that left ventricle. Are you going to survive? Probably not. And we call that the widowmaker. If you've ever heard of someone who had a heart attack and they called it the widowmaker, it was a blood clot in that left coronary artery, so on the left side. If you get a blood clot on the right side, still a big deal, but not as big of a deal. So here's the right coronary artery. This is the kind of hard to see. Left ventricle, right atria, right ventricle. If you get a blood clot on the right side, it's still called a heart attack. It's an acute myocardial infarction. But as it turns out, you can kill off a decent amount of your right ventricle and still live. You'll be what we call a cardiac cripple, and you'll have congestive heart failure, but not nearly as lethal as a left-sided, left coronary artery heart attack. Blood clot in the artery. Any questions about that? That was essentially the ischemic heart disease chapter in a nutshell. You get a blood clot in one of these coronary arteries, and it's going to kill off part of your heart muscle. Kill off part of your heart muscle. Now you have heart failure, which is that third chapter in this section. It's about break time, and then I'm going to pull up the PowerPoints that are loaded under this module, and we'll start hammering through some of those PowerPoints. So if no questions, then I'll see you guys back in about 10 minutes. We'll keep trucking.